It's an honor to be able to talk to you guys about how you can look after your body, look after your spine when you're working from home or working from a desk. Yeah, my name's Charlie. I am a chiropractor. I've been a chiropractor for 4 years now, and I work with lots of corporate businesses, and I have lots of experience helping people to improve their desk setup and improve their habits, so their daily stretches and exercises, so that they can keep their body moving and in as good a shape as possible, given the conditions that you're in. So what I'm going to cover today is I'll talk a little bit about desk setup, and then I'm going to talk about some really common postural habits that I've seen, particularly during lockdown. I've been back in practice now for about 3 weeks, and there's some very common themes. One of them I call lockdown neck. I've had a lot of people struggling with their neck and struggling with their shoulders. So yeah, there are some very common patterns. And then what I will do is I will break that down to why that is happening. And I'll show you some simple stretches and exercises that you can implement to help to reverse some of these changes and improve your day-to-day habits. Does that sound okay to everyone? Yeah, cool. Okay, amazing. So what I would firstly say is, whatever I'm going to show you in the video, it's really, really important that you listen to your body. We've all got a different body. We all have different things going on. Obviously, if you're in lots and lots of pain, ideally you want to talk to a health professional and make sure that anything that you do, that I show you, that you are careful and you do it at your own pace. So in terms of desk setup, obviously this is absolutely crucial for a number of reasons. The research shows that on average we are sat for about 6 to 9 hours a day, so it's a lot. As human beings, we aren't designed to stay seated for that amount of time. So number one thing that's crucial, Matthew touched on this as well, is that you have to have your screen so that it is facing your eye line. So when you are seated, you need to be sitting 90, 90, 90. So you need to have your feet placed firmly on the floor, sat back in your chair, your shoulders back, and make sure that your screen is in line, your eyes are in line with your screen level. That is absolutely crucial. Otherwise, what's going to happen pretty soon on is you're going to start struggling with your neck and coming through into your mid-back and into your shoulders. So included in the 90-90-90 rule, so I need to make sure you can see me here, you want to make sure that your elbows are tucked in line with your body. So also when you're thinking about your keyboard, so you want your keyboard so that you're nice and relaxed here. You're not reaching too far forwards. You're not reaching too far back. If your keyboard is too far forwards in front of you, then that will put a lot of strain on your wrist flexors and extensors. It's a very common repetitive strain injury that I see in clinic. So make sure you're here, 90-90, feet on the floor, shoulders back. In terms of how your screen is set up, whether you've got a laptop or a different kind of screen, you can get desk extenders from Google for about £25 if you don't have one already. If you don't have one and your desk is down here, or you're doing an iPad on the sofa, then straight away, at least make sure that you have a pile of books to raise you up. It's really, really important. Also, ideally, in terms of your chair, so you would have a chair that's got a little bit of movement and has a lumbar support. If you don't have a lumbar support in your chair, I think Jen put on the message on her email to make sure that you have a towel. So if you do, it's a really handy makeshift thing that you can use at home to help you. So feels like Blue Peter. This is one I made earlier. So all I've done is I've used a towel, I've rolled it up, and I've put 2 hairbands either side. So just making a tube shape like this. So what you can do is you can pop this in the back of your seat so that it causes that lumbar extension. So what we're trying to achieve from this, I'll show you, is when you're seated, what can tend to happen is we slump forwards, puts a huge amount of strain on our lower back here. So by placing a rolled up towel here, and when we sit, It's going to push our chest open and make sure that we have that nice curve in our lumbar spine. And when I'm talking about our lumbar spine, I mean this lower part of our back here. So when we're talking about our lower back and our pelvis, as I said, we're not meant to sit all day. So with our pelvis, it's designed to distribute weight from our body through our legs, through our feet, as we're walking and as we're moving. When we're sitting, it's not able to do that function. So what happens is a lot of the pressure comes through into our lower back. That's when we can be more liable for lower back issues and potential disc issues. So it's really, really important that you are super, super careful with your lower back when you're seated. All good so far? Amazing. Okay. The most important thing, and I tell everybody this as a chiropractor, especially when you're working from home, again, Matthew touched on this, you have to move. It doesn't matter how stellar your desk setup is. If you're in that position for too long, it's going to affect your body. So the research shows that it takes about 30 minutes for the muscles to fatigue. We've all done it. You sit like this in front of your boss, and then 10 minutes later, you're like this. So every 30 minutes, it's really important that you are moving your body. The research also shows that the top CEOs in the world do their best work in 90-minute slots. So my recommendation for how you would factor out your day in terms of movement is every 30 minutes, do something called movement snacks. So do a little form of movement so that you're moving your body and adjusting how you're moving around. I'll show you a couple of snacks in a second. Every 90 minutes, I would recommend doing a 10-minute walk or a 10-minute exercise. I will be showing you some exercises as we go along, which you're more than welcome to use, obviously. I also have, just while I remember to tell you, I have YouTube links to all of the exercises that I show you if you need to see those exercises again. Or if you have any questions, please feel free to get in touch. I'm going to say, so yes, so every 30 minutes you need to move, every 90 minutes it needs to be longer movement. There is an app called Focus Keeper, it's free, and that will alert you on the first 2 30-minute slots of your day, and then every 90 minutes it will tell you that you need a longer break. So it's a nice way to keep yourself accountable. So some nice movement snacks which you can do throughout the day. Something which you should do every day throughout the day is rolling your shoulders backwards and bringing your head back and holding it there for a few moments and back to center. It's a great way to reset our posture. Most of us, we're always checking our phone. Almost every movement we do, if you think about it, our head is forwards, which is why so many of us struggle with our posture and our neck and our shoulders. So it's a really nice reset throughout the day. Second thing, in terms of movement snacks, a nice thing to do is do some upper mid-back rotations. Again, it's a part of our body that we don't tend to get much movement through unless you're a massive yogi. So how you can do this is placing your hands behind your head. Make sure you breathe when you do it, and you can do some nice gentle rotations either side so that you're moving this upper part of your back. It's a nice way to keep your chest open as well. Another little movement snack you can do is standing up and sitting down out of your chair 10 times. One of the things that I recommend when you're changing your daily routine is keep it really simple and do something so that you're going to remember. So standing up and sitting down, make sure you squeeze your glutes as you stand up, and sitting back down. Again, you're resetting your body really easy. So, trying to think if I've not covered anything in terms of elbows. Yeah, so you need to move your body, that's really, really important. As I was saying, in terms of this forward head posture, this is the biggest issue I've had with patients since they've come back from lockdown. And Jen mentioned as well that some people have been complaining about having sore shoulders too. So one of the most common postural habits that I see is something called anterior head carriage. The next time you go to Sainsbury's or Tesco's, you'll notice that pretty much the whole population is doing it at the moment, whether they're in a desk-based job or not. So this is when, I'll show you from the side, your head comes too far forwards, your shoulders start to round. So your ear, ideally, should be in line with your shoulder. So what happens when our head starts to come forwards, you can feel this in yourself. You'll notice there's a lot of tightness around your suboccipital muscles. So these are the muscles that hook right underneath your skull. They are classic headache makers. Actually, 85% of the time, these are the culprits, so it's huge. And the reason why these get so strained is because we bring our head forwards. You'll also notice a lot of tightness in your jaw, most likely. And if you pretend that you're angry for a second, I never get angry, but pretend you're angry and go like this. These muscles here also get super, super tight. Again, because everything's coming forwards. Also, if you feel into your pecs, most likely tight, and your rotator cuff muscles. So if you come into, pinched into the middle of your shoulder, say, you'll notice that's probably quite sore. Under your armpit behind, that's also quite sore as well. So we need to stretch and we need to reset this. It is so, so important. If you think about your spine underneath as well, your posture follows your spine like a shadow. So if we're coming forwards, your neck should be in this beautiful C-shaped position like this. If you have a habit of coming forwards, what will happen is the shape of your spine will actually change. It can start to come forwards like this. If you think about the amount of pressure that that puts on your neck and on your nervous system, it's actually huge. And if you start to lose your curve, the research shows you can lose about 30% of oxygen to your brain. So we need to bring that back. It's really, really important. So in terms of stretching your neck, great place to start is rolling your shoulders and bringing your head back. You also need to stretch out your traps. So again, these are going to be pretty tight. So how you do that is shrug a shoulder and then turn your ear to the opposite shoulder and then relax the shoulder down. And then you can use your hands to deepen the stretch a little bit. So as a rule of thumb, any stretch or exercise that I show you, stretch for at least 30 seconds to really get in there and have a nice deep stretch. Make sure you're careful as you bring it up. Same on the other side. Might be quite tight actually, that's bad as a chiropractor. Give it a nice stretch in there. So what you can also do while you're here is you can stretch your scalenes, which is also an important neck muscle. So how you do that is keep your head here and then you simply rotate. So you'll feel the stretch coming down through here. Back to center. I'll show you on the other side to be clear. So you can rotate and then turn your head over. So you've got lateral flexion and also rotation. Is that clear? Okay, perfect. You also need to stretch out your pectorals. This is really, really important. So anything you can do to open up your chest. A nice thing to do whilst you're sat at your desk is something called Brugger's relief technique. So this is simply where you roll your shoulders back, you bring your elbows into your chest, and you bring your arms out so that you are rotating your shoulders outwards. It's a great way to open up your body and open up your chest. So as you do this exercise, make sure you bring it out and hold, and back in. Just like that. To stretch out your pecs a little bit deeper, what you can do is you can use a wall. Hopefully this will be clear on the camera. So if you imagine that you're facing a wall and you put your hand out straight in front, what you want to do is you want to turn away, pressing against the wall until you feel a stretch across your pectorals here. You'll feel it pretty easily usually. You can bring your hands slightly higher if you want to come into your pec major and slightly lower if you want to come into the lower part of the muscle. Again, 30 seconds, either side. Make sure whenever you're stretching your body, that you stretch both sides of your body. Another very common postural issue is that you have imbalance. For example, if we're right hand dominant, you might do a lot more things with your right hand. You're going to have more issues on that side. So make sure equally you're always stretching both sides. Okay. Let me just check my notes, make sure I've covered everything. So another really important thing which isn't always covered is how we breathe. Most of us, you know, it's a really stressful time. You know, we're busy, we have deadlines, and what can tend to happen is we can start to breathe from our chest. The reason why that's important to note is that I'm talking about all the tension that we carry around this area. So as a practice, just for a couple of minutes a day, ideally in the morning, I would recommend practicing using your diaphragm, so breathing from your lower belly, or at least checking in, taking a few moments. You can check now if you want. Just notice how you're breathing and notice whether it's coming from your chest or coming from your belly. Make sure you're taking deep breaths in through your belly so that you can tell your body to relax and we're not constantly using these muscles. It's really, really important. So the last thing is the towel. If anyone brought a towel with them, this is an amazing hack. So there's loads of research on this. It's called chiropractic biophysics. If you want to look it up, I can give you the website at the end. So you can buy something called a Denerol, which is the official tool to use for this. But this is a great thing to do to stretch out your neck at the end of the day. So yes, you roll up a towel, bands either side, so it's a nice tube like this, a medium-sized towel. And then I'm going to show you, I'm just going to point this down to my mat. Okay, so at the end of the day, what you can do is you need a flat surface and you've got your knees bent up. What you do is you're going to lie yourself down. This is going to come under the base of your neck. So I'll just show you here. It's going to come under this part of your neck. So as you lie down, make sure you relax as you do it. What you can also do, my sofa's in the way, you can also place your arms out for a nice deep stretch there. It feels so good at the end of a long day. Make sure as you come up that you don't lurch up. So what you want to do is you want to roll onto your side and push yourself up. You can feel a little bit dizzy after doing that, so make sure you're careful as you sit up. You can do this exercise for up to 10 minutes. And what this will do is throughout the day, as we come forwards, gravity works on our neck. By tractioning our neck back, we can use gravity to bring it back. Okay. It's a great little hack. So, you can also use a towel for this. I would recommend, if you don't have one already, to use a resistance band. Hopefully you can get them off Amazon. I know there's certain items that are really hard to get at the moment, but it's a really powerful tool to have in your toolkit. So you really need to strengthen your rhomboids and your lateral delts. These tend to be weak when we're in this position. So great thing to do first thing in the morning, so you're activating the muscles, is this exercise. So you can use your towel for this if you want, otherwise use the bands. So I'll show you here. So what you want to do is, again, make sure that your shoulders are back, you're not coming too far forwards, and you want to have your hands so they're facing upwards. So your arms come outstretched straight in front of you. And if you just practice a few times, bring your shoulders forwards and then squeeze them back and make sure that you're engaging those mid-back muscles between your shoulder blades. So then what you want to do is you want to squeeze and pull the bands all the way back, hold for a few seconds, and then bring it back. I'll show you again. You want to squeeze, bring this all the way back, hold for a few seconds, and bring it back. As a rule of thumb, what I would recommend for that will be 2 sets of 10 at least once in the morning so that you're using those muscles. If you want to go a little bit deeper than that, then what you can do is you can tie the resistance band together to create this. And then what you want to do is a little exercise called LTX. You're using the same muscles, it's just a little bit of a stronger strengthening exercise. So make sure your elbows are in, and what you want to do is you want to squeeze, again engaging the back muscles, and bring it back in. Squeeze and bring it back in. So this is the L, and then if you imagine you're coming into a T, we're doing the same thing here. Now we've got a little bit more resistance, and then you can come in either side. This is an X. So you would do 2 sets of 10 here. So you come here, 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 and here. Okay, everyone with me? Yeah, perfect. Okay. If you don't have a resistance band, it's not so great, but you can use a towel. So you wouldn't use this rolled up, you just use the towel empty. And what you can do is you can just practice. Imagine if you want to tear the towel in two, just really pull and make sure that you're engaging, again, these muscles between the shoulder blades. So really pull and squeeze for a few seconds and relax down. I'm going to show you one more exercise because this is such an important part which you need to strengthen. Okay, so I'll make sure you can see the mat again. So this is called, it's an exercise called swimmers. So you don't need any equipment for this. So what you want to do is you lie on the floor, make sure your forehead is down on the floor. You want to have your hands out in front of you. So then what you do is you raise your hands up. And what you do is you bring your arms all the way out to the side, keep your hands raised. You rotate them here and bring them back up to your spine. Show you one more time. Just like this. So again, 2 sets of 10 is a great number to keep you accountable. Okay. Again, it's one of those muscle groups which we tend to miss out on a day-to-day practice, so it's really important that we are doing it. So that leads me on to sore shoulders. So sore shoulders is a really common complaint that I get in practice. So usually when we're struggling with our shoulders, there's often a component with the neck. And the reason for that is that when we think about our body, our brain is always talking to our body through our spinal cord and through our nerves. So when anything is going on with the spine, that will affect the nerves coming down through to our body. And when we're talking about this forward head posture, it affects the base of the neck, and these nerves feed through around the shoulder and down to here. Also, most of us tend to have weak rotator cuff muscles. So that's the muscles that hold the shoulder in place. And we tend to do repetitive things. We're typing, we're writing, we're on our phone. It's the repetition that tends to injure the shoulder. So what you need to do is make sure that you are using your shoulders. So you need to mobilize them and you need to strengthen them. With any of these exercises that I show you, it's really important to remember that the first thing that you need to tackle is mobility. So focus on stretching, focus on moving your body, and then focus on strengthening your body. The mistake that most people make is they'll go onto YouTube, they'll put on this big, strengthen your shoulders workout, and they'll damage their shoulder. So make sure you take it step by step, assess where you're at, move your body, and then start to strengthen it. So how you can practice moving your shoulders is, if you've got like a broom at home, you can use it. If not, you can use a trusty resistance band, which I have here. I'm just untying it. So what you can do to work on your shoulder mobility is have your arms so they're wider than your pelvis, and just practice bringing your arms all the way over to your shoulder and down and all the way back up. It's a great way so that you're using the whole of your shoulder joint to move your body. So adding on to the exercises that I've already shown you so that you're engaging the muscles between your shoulder blades, a great one to add on to that, which specifically targets the rotator cuff muscles, is using a band, having your elbow in by your rib cage, and just using a resistance band to bring your arm out and back in, bring your arm out and back in. So by practicing rotating your shoulder, you're activating some really crucial muscles there. Okay, you still with me? Sorry, it's lots of information in one go. But if you implement these exercises, it can have a huge difference to how your body can handle day-to-day stresses. What I would say is some people do these exercises and think that things will change overnight. It does take time for your body to adapt to these changes. So stick with it. Give yourself a couple of weeks to keep going with it. So in terms of the, I'm going to show you one thing actually that's really, really important in terms of shoulders. So yes, your neck gets affected. Yes, your shoulder gets affected. A lot of people struggle with their elbows and with their wrists as well. So a really nice little thing that you can do if you're struggling with your elbows is have a little feel into your elbow. So if you come into here and just move your thumb up and down, you'll probably notice it's quite sore in there. You feel it's quite sore, quite tender. There's usually a spot, so just on the top of your elbow. So this is a very common spot where we can get something called lateral epicondylitis, that's tennis elbow, from doing this. So just by massaging the area around your shoulder, around your elbow, that can really help to release any nerve entrapment coming through. In terms of your wrists, you need to keep them mobile and strong. Have you noticed that there's a theme here? So make sure that you are doing some form of wrist exercises every day. So that can be as simple as stretching them back and stretching them forwards. What I would recommend though is that you need to be practicing, ideally on a daily basis, some kind of strength building exercise for your wrists. So again, sorry to keep bringing this down. I need my own studio. So just practice bringing your weight forwards onto your wrists. It's a great way to strengthen them in a not too intense way. So just practice it. So just moving your weight forwards until you feel the pressure on your wrists and moving in all the directions. So you're working on all the little wrist bones. If you can hack it, you can also move your hands the opposite way so that you're really stretching into your wrists. I have to do this multiple times a day because being a chiropractor, I'm using my hands and wrists all the time. So the second most common thing which I tend to get as an issue is lower back issues. So something called lower cross syndrome. This tends to be more common in women in terms of the postural habits. But men get it too. So I'm being very sexist here, but it's just what I tend to see more in practice. So women tend to tilt more this way, okay, and men tend to tilt more this way. So the reason for this is it means that generally we don't have a strong enough core or strong enough lower back muscles to be able to hold our spine into place, which means we get more strain on our lumbar spine, and that's when we can start to get symptoms. So the kind of symptoms that you can experience from this are having a super achy lower back. Sometimes we can get radiations down the legs, so like shooting pains or numbness. Sometimes you can notice that you feel that you have restless legs at night time. So what you need to do is you need to stretch out your glutes, stretch out your lower back muscles, and strengthen up your core and your glutes as well. By doing these things, you can actually help a multitude of different lower back issues. It's often the case when someone comes in with a problem that there's a glute or a core issue. So really simple stretches that you can do that I recommend doing before you go to bed is what happens throughout the day when we're sitting is that things compound over time. So what you want to do is have a little stretch out at the end of the day. How I would recommend that you do that is lying on your back. Simply bring your knee up to your chest, 30 seconds. Bring your knee across your chest, 30 seconds, to really stretch out this bit. Whilst you're lying on your back as well, you hug your knees into your chest and do some sacral rocks. It's a nice way again to get some movement through the spine. So when I'm talking about your sacrum, this is the triangle bit at the bottom of your body. And this tends to take on a lot of compressive forces when we're seated. So by doing those rocks, it's a really nice way to create some movement through all the little tubercles that you get in the bottom part of your spine. So in terms of stretching out your glutes when you're seated, that's a super, super easy one. Most people should know this one. So as you're seated, feet placed on the floor, you want to bring a foot up here and you want to push your knee down and lean forwards until you can feel a stretch into the side of your glute. Check that that's clear for you. Okay, yeah. So popping the leg here, you want to reach forwards and push down on the leg so you can feel a stretch across the side of your glutes. Again, 30 seconds on either side. You also need to be stretching your hamstrings. So how you can do that is you can use your chair if you want to. So just popping a leg on a chair and reaching forwards so that you can feel a stretch through your hamstring. In terms of strengthening, I'll show you a couple of exercises which really help with that. There are a million things that you can do to strengthen your glutes and strengthen your core. I'm not interested in you having a six-pack, but what I am interested in is that you have enough strength in your body so that you can functionally do everything that you want to do. So I'll just show you a couple of exercises that you can do to help you with that. So again, I'll point you down and I'll stay on the mat this time. You can see me. So in terms of engaging the core, we have to make sure that we can protect our lower back. So a great way to start is doing an exercise called dead bug. This is also a spinal hygiene exercise. So what you do is you lie on your back and you have your knees up to 90 degrees and you have your hands out in front. You alternate your arms and your legs. So you bring one arm and one leg out, making sure that your lower back stays on the floor and your core is engaged, and then you come back to center, and then you want to swap. So that is dead bug. Again, you can do 2 sets of 10 of those. And a great one for your glutes while I'm here is glute bridges. You can use a resistance band for this as well if you want to around here. What you want to do is squeeze your glutes, lift up, squeeze here for a few seconds, make sure you're engaged in this area on your core, and then lower back down. The last exercise I'll show you in this set is called bird dog. So you want to be on all fours for this, make sure you have a neutral spine, that's really important. And then what you want to do again, you alternate arms and legs, so you pop one arm and one leg out, and back in, and swap one arm and one leg out, and back in. And again, while I'm here, another great spine hygiene exercise to do is cat camel. So as you breathe in, drawing your back up, and as you breathe out, drawing your back down. Movement is the spice of life. So if you can take anything from this video, it's so important that you are regularly moving your body. So is everyone still with me? I feel like yeah, perfect. So just to recap, the most important things are to be moving your body every 30 minutes, big movement every 90. Make sure you're resetting your posture as often as possible, especially this forward head posture. It's one of those movements that we just never do in actual life. Make sure that you're stretching your lower back at the end of a long day, and make sure that you're doing your movement snacks and you're doing some kind of core engagement. Another thing which isn't really to do with posture is make sure you're getting your sleep. So many people come in with issues, and if you're not getting enough sleep, you're not giving your body enough time to repair and restore and fix itself from the day before when you were sat at your desk. And so that's really, really important as well. If you have anything crazy coming on, this is the last thing I'll touch on. Crazy, I mean, if you're in loads of pain or something that really worries you, reach out to a professional. Gently move your body if you can, and I would recommend using ice to reduce inflammation in the area. So say, for example, if that's your lower back, just applying ice for 10 minutes can help to reduce inflammation and give you a little bit of relief. And I'll breathe.
Thanks so much, Holly, that was excellent, thank you.
Oh good, you're welcome.
So thanks everyone for joining our session today. Just to recap on there's some information there from Matthew about the importance of the risk assessments if you're a competent person, and that those have to be done by an employee of the company. So if you need any advice or help about if you need any more training yourself, someone else in your firm needs training, you can reach out to Matthew. He can be in touch to help arrange that. And then Charlie is obviously available for sessions that you want to conduct with your own employees and team, because I think you'll agree, if you can go some way to showing that you've been looking after the spinal health of your team, then you're going to make sure you're in a good position if any issues come up further down the line. So thank you very much for that, Charlie. And as before, we'll put the notes into the HR and office managers group on LinkedIn. So if you're not part of that group already, just drop Jen an email. I think most of you are, but that's where we publish all the content. I think, Matthew, you were going to summarise some of your key takeaways because we lost your audio at the beginning there. So that would be really helpful if you can do that for us, and we'll put that into the group as well.
Absolutely.
Thank you. Over to Jen. Any more that you want to say, Jen?
Oh no, that was just really great, really practical. I am guilty of absolutely every wrongdoing that Charlie's probably seen. So yeah, that was really great. Thank you both so much, and thank you for joining us, Matthew and Charlie.
Thank you for having me.
Thank you, everyone, and we'll look forward to seeing you on our next Zoom room. We'll send out the topic over the next week or so. Thank you.